No medicine can remove the cause of a lifestyle disease, but you can. Welcome back to Lifestyle Disease Doctor. In this second part of the 4-part series on fatty liver, chronic liver disease, and its progression, we look at what are the current and latest treatments available for these diseases. Today, we have Dr. Jolly Thomson with us, who has extensive experience in lifestyle disease treatment utilizing lifestyle correction. Here we begin with what are the first lines of treatment for liver diseases.
In modern medicine, the liver disease management depends on the cause of it. If it's just a fatty liver, it will not be, one of the cases it will be just a fatty liver. There will be some associated disease also. The fatty liver, and before that there will be either some liver infections like hepatitis A, B, or C, or something like that, or alcohol like nature will be there, or obesity, that is excess calorie, excess fat deposition in the body will be there, or there can be some drug continuously taking and it is some reaction because of this fat accumulation and liver damage can be there. So first to find out what is the reason for that. If there is only obesity or some excess fat accumulation and the fat accumulation in the liver, so grade 1 fatty liver only, then it can be managed. Doctors will advise just reduce the calorie, that is carbohydrate and fat, and do some exercise and lose for a few kg, how much is excess fat is there or excess weight is there, reduce that. Then you can do a repeat scanning and see. Usually the fatty liver is diagnosed, it's an ultrasound scan finding. So you can try for 2-3 months this your own lifestyle correction, and then look for what is the stage of the liver, fatty liver, and it should make sure that it is reversed. If it is not reversing or you are feeling tired or some other problem you are feeling, then it has to be taken seriously. And also if you are taking some medicine and you are seeing that fatty liver is there, then also you should be very careful, because all the medicines are going into the liver and it will increase the workload. Liver is already sick. If the fatty liver or the cirrhosis or fibrosis is there, the liver is sick, then you are eating all the medicines and it will be actually troubling the liver further. So it is very important that we are taking continuously the chronic medication, is because for the lifestyle diseases only. So liver is getting sick because of your lifestyle disease itself, and also this medication you are taking for the lifestyle disease. So try to come out of the lifestyle disease and make sure that you are living without medications and without lifestyle disease.
Some patients are prescribed statins or diabetic drugs for their fatty liver. So they generally feel that those drugs will take care of their fatty liver. What should they understand?
See, usually given drugs are, one is this statin, that is anti-cholesterol medicine. Next is metformin. Metformin is an insulin sensitizer. And in some of the doctors, this call it deoxy, that is one bile salt. The name is very difficult to pronounce, so I don't want to go into. So one bile salt, that is bile juice, which is secreted by the liver, as a supplement to support the liver. Actually, this bile salt is made by the liver. So when the liver is sick, okay, you give it ready-made bile salt, I will give, and that is the way it is done. The problem is when we are taking all this, when you are taking metformin, that is actually a diabetic medication, type 2 diabetic medications to increase the sensitivity, but it doesn't have much of the role for the fatty liver actually. And actually this medicine also is going into the liver, and it has to remove all this, the liver has to metabolize it, just remove it. And thus when you're taking statin, even more difficult for the liver, because liver is the producer of the cholesterol. Cholesterol is needed for many functions in our body. Cholesterol is needed for the sex hormones, all the sex hormones, testosterone in female, and pregnancy hormones, estrogen, progesterone. Even the corticosteroids, that is the mineralocorticosteroids, which is actually controlling the electrolytes balance and the urine production, etc. It is controlled by that. So even the vitamin D production, vitamin D is produced from the cholesterol. even the cell production, cell wall, the cell membrane is produced, cholesterol is a major ingredient. And even the brain, cholesterol is major ingredient. So that is why the brain, the cholesterol is very important. That is why many of the patients who are taking the statin get memory problems. Actually, it is very evident for some actually. After taking for 3 or 1 or 2 years, or after, even many of the report within 2 or 3 months itself, the memory is reducing. They are not able to remember the breakfast what they're taken, or the phone who has called, or what I had talked. So if you are feeling that we should taken it very seriously, the cholesterol deficiency, those who are taking statin, otherwise also the memory problems can come. If you are on statin and your memory is failing, you should be thinking about that also. So as such, for the medication has a very limited role only in that. And some diabetic, anti-diabetic medicines also, the newest one of two is saying that it is can be used for this cholesterol and triglyceride also. But I have seen so many prescriptions, the patients with such prescription, but their cholesterol and the triglyceride will be high, and some with the cholesterol, the statin, it will be very low. Diabetes, the cholesterol will be controlled, but the triglyceride will not be controlled. Actually, not the cholesterol. The troublemaker is the triglyceride. Triglyceride is the fat. Actually, cholesterol is a component of the HDL and LDL. That is the transporter. It's actually the fat is transported inside our body, inside through the blood vessel, through with this HDL and lipoproteins in the form of lipoproteins. These lipoproteins can be HDL or LDL, and depending on the content of fat inside, the triglyceride inside that. If too much of triglyceride is there, it will be low density lipoprotein. That is called the bad cholesterol. We take it LDL, bad cholesterol. The HDL, that is good cholesterol. That is with less triglyceride, because we all know that the density of the fat is lower than water. That is why it is floating up. So that is the same situation. It is heavier when there is less fat. So less fat cholesterol, the truck with the less fat is better than, because there can be ample space for taking the fat actually. That is the only difference actually. We should understand that when you are seeing the patient also should have an idea about what is good cholesterol and what is bad cholesterol, LDL, HDL, etc.
See, you were mentioning that the different stages of liver disease and fatty liver, basically the changes are not very much noticed till it is reached a very serious stage. Now, what are the stages as far as a patient is concerned, that they should know that that, see, if I am at this stage, this is what I should do. If I am at this second stage, this is what I should do. Anything like that to guide the patients, so that once they know what stage they are in, immediately they will have to take all necessary steps on their own part. Because from what you said, the medications and all those sort of things, they are very limited. There is hardly anything that can be done. So what is it that patient can relate to the stage in which he is?
Everyone should do a yearly scanning to see fatty liver. Actually, many of the Western literature, actually, they are saying that 30% having fatty liver, or 25%, 30% and all. But in my experience, it should be much higher in our population, at least in Indians, because we know that the Indians have a protruding tummy even by the time they're BMI 23 itself. Generally, the Westerners, this Caucasians, generally 25 BMI is the upper limit. But the people is generally considering the upper limit is the normal. It is not the upper limit. For the health, especially those who are this physically not active, low normal BMI is the ideal. So in Indians, 18 to 23 is ideal. If at any stage, if it is 23, you don't have a protruding tummy and excess fat is not there, it's okay. If you are more muscular, that's no problem. 15% fat or 25 to 15 to 20, up to 25 for the ladies, it's okay. But if it is more than that, we should be careful about it. So you will be getting a fatty liver. So in the early stage, you just see that the abdominal circumference, and if it is increasing and it is protruding, reduce the weight and see that you are going to low normal BMI, and check the ultrasound scan because ultrasound scan is not harmful. It is not like a CT scan or MRI. So it is cheap, it is very economical, and it is there's no side effects. So after 3 months, you do the lifestyle correction by the self and find out and see that it is reversed. And if you are taking medication for other things, then you have to be very careful, and you may need a support. If you are taking finding fatty liver grade 2 or 3, and you are taking medication for the diabetes, hypertension, cholesterol, heart disease, etc., then we had to get expert guidance for the to come out of the medication also. And it is very easy also. Actually, in my experience, I'm giving this clinically supported lifestyle correction. It's very easy to come out of in the early stage of the liver disease. Coming out is very easy, and also to type 2 diabetes, type hypertension, this coronary artery disease and all. Within a month, we'll be able to come out of all the medicines, and within 3 months, the fatty liver stage will be reduced. Definitely, if the patient is following the things like correctly, the weight reduction also will be there, and the ultrasound scan, the fat reduction also will be there, and this fatty liver will be reduced to next level, lower level.
Since you mentioned that those who are having fatty liver, it is something like a systemic disease, so that it is a symptom of that, and they will be also having other diseases along with it, like diabetes and other issues. So when this patient comes for treatment, does how do the other medications affect the fatty liver or the chronic liver condition?
Usually, these chronic medications will be used for the lifestyle diseases, especially of metabolic origin, like diabetes, hypertension, heart disease, etc. Along with that, there will be definitely the fatty liver also will be there. The problem is liver is also sick. Metabolic syndrome, that is metabolism, is the liver is the center of all the metabolism. So whatever you eat, it has to be metabolized. Even the drugs, the medications you're eating also has to be metabolized. That is happening in the liver. So when the liver is sick, if you're taking even the simple medicines like painkillers like paracetamol or this statin, it has to be digested, and for the digestion it is helping, and also for metabolizing that it has to be this medication is not nutrients actually. It is actually body will be or liver will be considering it as a toxin, so liver has to remove it. So already liver is sick and you are putting some more and more medicine, so liver will find it difficult and it will progress if you are continuing with the medicine and you are not correcting the lifestyle. And then the fatty liver grade 1 will proceed to grade 2 and grade 3, and along with that hepatitis will come. This liver function test, the SGOT, SGPT and all will go high, and it will go to stage 4, and now we have fibro scan also, so that will give the elasticity of the liver, and it will also go high in the higher level, and then go for the cirrhosis, that is fibrosis is happening, and that is called the liver cirrhosis, and the liver will start shrinking. And there will be some cases there will not be shrinking, there will be some cells will be accumulating fat, and the initial stage actually with the fat accumulation the liver will be enlarging. Then at a later stage it will start shrinking, and then the portal hypertension, this blood vomiting, ascites, there is not the albumin, that is protein which is actually keeping the blood inside the blood vessels will be reduced. So then there will be edema will be there, and the leg will be swollen with edema, this accumulated fluid, and also the tummy will be protruding with the ascites, and so it will progress like that. So we had to avoid that. So at the stage 1 fatty liver itself, we should be taken care. And it's all lifestyle disease. You have to manage it with lifestyle. And also remember that there's no medication for this fatty liver or any of these liver conditions. So only the medication is for the viral fatty hepatitis, viral hepatitis, but also the medication's role is very minimal. There is no really effective antiviral also. So we should take care and give minimize the toxins, minimize the medications, reduce the calorie intake, and make sure that all the essential nutrients are there so that the liver can function easily. So it can liver can do its duty only if you give essential nutrients. So that we should be aware of it.
Actually, from what you said, taking medicines, generally everyone feels that taking medicines is something like that medicine goes into your stomach and then it goes to where it has to act, and then it does something. Suppose I have a pain here, maybe I take a medicine, a tablet, and the tablet, some part of it goes here and then acts there. That's what I generally think. But you are saying that, the medicines, any medicine for that matter, almost all medicines, when they are taken, they have to be acted on through the liver. So that means whatever medications you take, the liver has to work on that. Is it like that? Or is it, just a very simplified version of it? Can you explain, if you take a medicine, what does the liver do? And what is the type of strain that a liver is put to?
See, when you are taking a medicine, the first thing, it has to come into the intestine and it has to get absorbed. If you are taking a sublingual tablet for a heart pain, it will be directly absorbed from the mouth itself. Sublingual means you are applying the tablet under the tongue. So it will not directly go into the liver, but it will be absorbed into the bloodstream. So there will not be any first pass metabolism. First, if you are taking oral medications, everything is going into the liver first. It will be absorbed from that and directly going into the liver. And liver consider it's a toxin, and liver will destroy it as much as possible, 80 to 90% or 95%. It will be destroyed, and then it will be the drug part, which is 5% or 10%, which is escape the liver cells, will be going into the systemic circulation, and it will be distributed all over the body, not in a particular place. You will be taking a pain for your wrist, but the medicine is going everywhere in all the cells in the body. So that is why the medicine side effects comes. Almost every medicine, if you are taking medicine for one disease, the other may be increased. If you are taking medication for the joint pain, your heart can be affected. So many of the medications, this painkillers, has been withdrawn from the market because it is affected. It can give the heart attack risk will be high. So that is the way. So for the liver, all the medicine liver considered is a toxic, and whatever medication you take, it will be becoming a strain for the liver, and it will automatically support the progression of the disease.
Actually, from what I understood is, the medications actually are passed through a process of the liver, at least the majority of the medications. So in general, medications create strain. So even it appears like even the best of medicines can actually be a problem for the liver if your liver is not healthy. Is it true?
Yes, definitely. If you look into this pamphlet or the prescription instructions, many of the medicines cannot be used for a person with liver disease. That we should, almost all the medicine, there will be written a specification that it should not be used for it should be careful, or it will contraindicated for the liver patients. And definitely there will be kidney also will be there. But when we are focusing today, we are focusing on the liver. Then all the medicines, there will be such instructions will be there. Even if the statin, when many of the European countries have started giving notification, because statin is many of the places it is over-the-counter medicine. So if you have fatty liver or liver problems, you should be careful about not take this over-the-counter statin. So such instructions are there. Actually, even this statin also will give a double strain. Actually, one is liver has to metabolize it. The next is it is actually the liver primary function is producing cholesterol, and this is blocking the production of the cholesterol. That will be definitely a strain for the liver.
From what you have said, if a person has a problem with the liver and then he has other problems like, say, diabetes or hypertension or cardiovascular issues, from what you said, the person should first get his liver right. Then only he should actually look at the other parts of it, because otherwise everything will affect it in a wrong way. So in such a case, what is your experience? Because you are actually focusing on clinically supported lifestyle correction. what is your message for those who are having other diseases for which they are taking medication and then they find that they have a problem with their liver?
See, I remember one patient who was diagnosed with liver fibrosis for stage 4 and a cirrhosis. And he's non-alcoholic. And it's actually he's a lean person. He's not obese or anything. But he's taking medication for the diabetes, hypertension, cholesterol, and a blood thinner for the heart disease also. So all this medicine he's taking, he's coming and telling me that, doctor, I am not. I said we had to reverse we had to reduce the medication also. He's very insistent that he doesn't have any problem with the diabetes, hypertension, and all the. He's very comfortable with the medication. I am bothered only about this fibrosis liver. I am worried about, doctor, only the fibrosis. I want to correct this fibrosis. So this is very common for many of the patients. Actually, they'll be okay with the medication for other things, diabetes and hypertension and all. So we had to understand that the first disease came is insulin resistance. The diabetes came first. And then along with that, when they start the anti-diabetic medicine, the hypertension came. Or maybe hypertension had come first. And actually the reason for this hypertension is accumulated fat inside the blood vessels. So the blood vessels become narrower and the heart has to pump strongly. And when the heart has to pump strongly, the heart muscles will be enlarged and it can go into heart attack and all. So we had to correct from the base, and from this insulin resistance also playing a part in the liver, fatty liver, the initial stage. And so we had to start from the basic problem. That is lifestyle. It related the diabetes first, hypertension next. So it is a process actually. It is a metabolic syndrome. We had to correct all the aspect of the metabolic syndrome. So the most satisfying thing is we can correct all this within a month itself. This medications can be. So it's full correction. I'm not meaning about the full correction. But the diabetes, if it's a type 2 diabetes, if you are following the lifestyle correction method we are following, the first day itself we can stop the diabetic medicine. So the liver strain is reduced. Usually within 1 or 2 weeks, if it is only 1 or 2 BP medicines is there and the kidney is not failed, within 2-3 weeks the hypertension medicine can be reduced and tapered off, and the cholesterol statins can be tapered off, and the everything. Actually we do everything that this evidence based, like following with 4 times. Usually in the diabetic patients not left alone with just stopping the diabetic medicines. So 4 times blood sugar should be monitored, and it should be made that make sure that it will be between 70 to 140 even after food. 70 to 140 is the limit we keep. And also the BP has to come down to 120/80 or 130/90, and when we start reducing, and the BP it's gradually actually, and see that the BP is controlled without medication. And the cholesterol will be checked every week, and see that this lipids will be checked, and the cholesterol and triglyceride in the normal range. So in that way it is possible only.
With that, we come to the end of this second episode, where we looked at the latest possible treatments and especially the limitations of treatment and the necessity for lifestyle correction. In the next episode, we look at the various comorbidities associated with liver disease and fatty liver, and also the complications associated with these diseases. Thank you. The informed patient is key to treatment success.